Okay. Oh, yeah. AJ is doing it again, no. And I wanted to check it out before.
You'll get it.
Bingo, here. AJ, you can. Good evening, everyone. Welcome to Medical Mondays with Dr. O, where we share knowledge and grow to prevent disease entities. I am Toyin Opesanmi, a family practitioner, HIV specialist, and I treat addictions, substance use disorder in Maryland. I enjoy what we're doing tonight, sharing knowledge, growing to prevent preventable entities that could impact our health negatively, and also to gain knowledge. Tonight, we have our very own Dr. Oluyemisi Famuyiwa, who is going to tell us about the urgency of egg freezing, the need to freeze eggs, and when to. We're going to learn a lot tonight. So welcome along with me, Dr. Oluyemisi Famuyiwa. You have the floor. And by the way, I've got to remind you that we are not establishing physician-patient relationship. We're here to learn, to grow, but not having that relationship. Thank you. The floor is yours.
Thank you. Good evening, everybody. Thank you so much. You're such a kind and gentle audience to me. I love being here. I've learned so much myself. So this evening, I think I'm going to continue along the same themes I've had my past two lectures. We're going to talk more about the egg, but I want to do a little bit of a different twist towards the end, and I'll hopefully elaborate why. I think everybody now, I hope, has heard about egg freezing. And so tonight I want to explore what happens after the fact. So we've been freezing eggs for several years now, and now we're starting to see people come back to use those eggs. And there are several studies coming out explaining that. One large one was from New York. And so we will talk a little bit about what happens after the fact. Now, just as a slight refresher, my slide is, oh, there we go. Just to remind everybody, where do eggs come from anyway? Well, when you're a baby or a tiny, tiny embryo, as you are forming, there are certain cells, the initial cells, they're called progenitor cells or stem cells. These are the cells that are called totipotential cells. In other words, they could derive into any particular organ. They could grow up to be bone or muscle or hair, but there are a few thousand that are set aside that certain signaling happens around where they are that makes them develop along the lines of either testes or eggs. So very few, not a lot. But what happened was some of these few thousand eggs will undergo rapid division, several million-fold, and will yield up to 6 to 7 million, we call them primordial germ cells or oogonia. And this rapid state usually ends around week 20, 21. That's when you have actually the most eggs when you're in your mother's womb. Now, this sounds like madness because you grow rapidly to die rapidly. So what happens now is After that initial rapid growth to 6-7 million, then there's a gradual decline to the point where at birth, you're now down to 200,000 or so. They go through what is called the programmed cell death or apoptosis. All right. Now, these leftover eggs, they've gone through the process of mitosis, which is where you divide to create two equal daughter cells. The next phase of division is called the reduction division. That's when the DNA goes from, 2N or diploid state down to 1N in preparation for when the egg is fertilized by the sperm, right? So the sperm has 1N capacity. You also need the egg to be down to 1N so that when you now combine, you form a 2N 46 chromosome complement individual, okay? Otherwise, you'll have tetraploidy and all sorts of mismatch. So they initiate this phase of reduction division. The first part of it, and for those of you who are scientifically curious, is called the prophase, the dictyten stage of prophase, and they are halted in this stage. And this stage of halt is going to exist until they start ovulating. So imagine from birth till around 12, 13 years, they're suspended in suspended animation, okay? So that's typically the story of where eggs come from. Now, after menarche being when the menstrual cycle is initiated, there is a continual decline of this so-called maybe 200,000 eggs, so that by the time a woman is, say, in her 40s, you're down to about 1,000. You're losing them in the same program cell death, but you're also losing them because each time the brain selects one egg to ovulate, it actually captures, if you will, a basket of eggs. And out of this basket, it's going to choose one to ovulate, and then it's going to dump the basket. So you're losing eggs both from that process and also from a background continuous loss. Now, in addition to losing the quantity, the quality is also starting to go down. So the ability of the egg to be fertilized and to yield a live baby starts to go down, such that by age 40, only 4% of those eggs have the potential to become babies. All right? They can, but it's reduced. Now, what therefore can we do about this? You can try to sort of suspend the eggs in a state when you still have a lot of them, and in a state where the quality is still good enough to give you a high chance of having a live birth. And we'll talk about what are the things that you can look for to see if your chances is following a normal pattern, or in some patients, it could actually be undergoing a rapid decline, right? And sometimes it's tragic because you may not be aware that that is happening, right? If you don't do certain tests. What are the disadvantages of egg freezing? Well, in real estate, they say location, location, location. In fertility, we say time, 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 time. When are you choosing to freeze your eggs? Because depending on when you freeze, at what age, you may be surprised that not all of those eggs will actually thaw very well, right? Of the ones that you can successfully thaw, not all of them will fertilize, right? And if you are lucky to get them fertilized, not all of them will give you a normal embryo. And I think that's the key take-home message from today, is what happens when you freeze it at different time points. Critical. Now, I know this slide is busy, so we're going to take it one step at a time. We call frozen eggs vitrified because that's just a technique that is now used to freeze the eggs. So we no longer do the regular old-fashioned slow freeze. When you thaw them, survival rates can be anywhere from 80 to 85%. So you see, you're going to lose some off the top right there. Now, let's assume the best, and you thaw them successfully. Maybe if you're lucky, 70% will actually fertilize. Now, there is a calculator that was developed by Brigham and Women's out at Harvard for you to calculate and plot in your age and everything to see what your own thaw rates can be. The problem with that model is it tends to be overly optimistic. So you can take it, be careful because it may be predicting higher than you actually have. Now, when we look at an egg, we classify it as extremely immature, the germinal vesicle stage, an M1 stuck in metaphase 1, or a fully mature M2, metaphase 2 egg that's fully mature. A fully mature M2 has the capability of producing about 25% chance of resulting in an egg, right? A less mature egg, an M1, probably will only give you a 3% usable embryo. It's not zero, but it's not the best. So when you are freezing your eggs, what you want to pay particular attention to is how many of those eggs are GVs, how many are M1s, how many are M2s. And we are going to talk about this with my last slide, because if you go through a cycle and you don't have a lot of M2s relative to your M1s, you might be better off seriously considering a second, and some people even do up to 3 cycles to try to accumulate more of the mature ones, okay? Now, here's the crux of the matter. For people coming back to use those eggs, right? What is the live birth rate per attempt, okay? If the eggs were frozen before the age of 38, and you have about 20 M2 mature eggs frozen, then your chances of having a child is high. It's even higher if you have the embryo tested to make sure it's genetically normal. And that's why you see that 55%. Those are embryos that have actually been tested. The untested embryos will not be as high because, some of them may be abnormal. So how many should you freeze? Well, the best time to freeze your eggs is really probably before age 35. I would say between age 30 and 35. You can still freeze if you're 35 to 38. You may need to do more than one cycle, though, in order to get up to 20 mature eggs. If you are 40, you may need more than 2 cycles because you may not have a lot of mature eggs, right? So people who are older, who have only 1 cycle frozen, probably will have a lower chance of a live birth. Now, is it better to have 3 cycles? It depends, because you have to realize the people going through 3 cycles are the people who are not making that many eggs anyway, and probably don't have a lot of mature eggs. So that's telling you that those are the patients that are having problems with egg quality, right? So at that point, you may hit a flat line where it's really not doing much of any good for you. And finally, for patients who want to freeze their eggs, who are over the age of 42, 43, those eggs are probably not going to yield a live birth. And I think that's where the disappointment comes in, because most women, when they freeze their eggs, they are happy and elated, but it may be a false sense of, a false sense that you're secure. All right. And that's the take home message. Don't think, oh, great, I've frozen my eggs, I'm all set. You may not be all set. Those eggs may not do what you want them to do. Okay. So I have come to the end of my slides, and I'm going to stop here and we can talk.
Fantastic. Oh my gosh, that was succinct and straight to the point. Excellent delivery. I mean, clear. Totally understand. I have a question. I'm going to ask my question really quick before I shoot and ask, the one there. So if anyone has a question, you can raise your hand to ask it yourself. Is the best way to do it, because then you can interact, or you can write it in the chat box and I will help you ask it. So when freezing the eggs, you said,
yes,
it's important to know if they are M1 or M2, they need
correct.
to know which are matured or not matured. So when these eggs are frozen at that point of freezing, will the patient be told these statistics?
Absolutely.
Okay.
I know I do. We give them a printout of every single egg that we got from them, whether it's mature, whether it's immature. And we also go beyond that. We also tell them the quality, whether it's an A grade or a B grade or a C grade, and what numbers. So they get that final report to take with them. So they know, and I can sit down with them and say, okay, here are the mature eggs we got. Here's the quality, morphologically speaking. And some women, I do counsel them to say, you might really want to do a second time, give yourself a break. And then other women, I have a lot of women who've frozen their eggs at age 32, 33, who have wonderful oocytes, who have all mature oocytes. And actually, if they have anywhere from, 15 to 20 at that age, they're probably good. They're probably all set. And then there are some patients where you would think they're 37, 38, where we simply had to just stop. There was nothing there. There was no response. It wasn't working. So all they were doing was burning through medication without any response.
Chai. That's always sad.
Yes.
So I have a question in here that says, what is the impact of something we call freezer burn on proteinaceous tissue? When you're talking about freezing the eggs, do one need to worry about that?
So they're probably talking about regular food you put in freezer and you get freezer burn. This is a whole different issue. When we're discussing freezing eggs, I may be using the word freezing, but we're actually freezing them in liquid nitrogen, and they stay in liquid nitrogen. So there is no such thing as freezer burn. They can stay suspended indefinitely.
Fantastic. Thank you. You know, that's a question that I've had people ask me also. So this is a question from, a gentleman in Nigeria, Mr. Benjamin Oluyemisi. I want to thank the men on this platform tonight. I've noticed that, every time we talk about women and women issues, some men still show up because you know what? It hits home for men too. You have daughters, you have nieces, you have sisters that can benefit from this information, and you know that, and you show up. So I personally appreciate you. Thank you. And thank you for participating, because the more we learn, the better our society, our community as a whole will be. This is not just women's issue. It's both men and women, young and old. You have, grandchildren, children, the list goes on. So the question is, he said he has some friends in Nigeria, and he called in from Nigeria, who are in their 40s, yet to be married, and they don't seem to be aware of this opportunity. The question is, what are their chances of being on the winning side when it comes to having children if and when they do get married, or they're ready to have children?
Yeah. So again, you have to look at how old are they, right? So in their late 20s.
They're in their 40s. They're in their 40s,
Oh,
he said.
gee.
He said he has some friends in Nigeria who are in their 40s, yet
When you
to
say
be married.
40s, are you talking about 41, 40, 42, 43, 44? Where in that 40 spectrum are you? Now, bearing in mind, when people age of 40 who freeze their eggs, you have like a 3% chance of having a usable embryo. 3%. If you're over age 44, it is highly unlikely that you're going to get a live birth from freezing your eggs. So at that point, that's when they need to start exploring donor egg. But so, we don't advocate freezing eggs over the age of 38 only because the statistics are so low. But you take whatever you can. If someone's 39, 40, fine. As long as they're properly counseled that you can do it, but what is your plan B when you come back 5 years from now and we thaw those eggs and you find out they're actually no good and nothing comes out? Because that can happen. Chances are, number one, they may not even survive the thaw. And number two, they may not fertilize, and they may not yield a keyword usable embryo. It's not zero, right? But you don't want to give people false hope, because when you say it's not zero, everybody's going to say, well, yeah, that 1% is going to be me, right? And so I think that one has to be very careful and cautious when counseling patients. I always tell my patients, what is your plan B? Not to be mean, but to be realistic. What is your plan B? But for someone who's 44, I probably would not recommend freezing their eggs.
The response from Mr. Benjamin, was his response. And I think this hits home because it does know people in this category. And a part of his question actually hit me. He said they don't have access or opportunity to this information. They don't know. So Mr. Benjamin, I would recommend that you have them go to YouTube, Medical Mondays with Dr. O, and look at this episode again. And Dr. Famuyiwa also have a podcast. I think I'll let you talk about that. Go ahead.
Correct.
Yeah.
So yes, I think that a lot of people are really unaware. So I've almost made it a life mission to be drumming out the beat, to be saying it out there, because people they really honestly don't know, or they're busy with their lives, they're professionals, and so many things are going on. But here's us telling you, you know what? You can actually have it all, maybe one at a time, but you can have it all. You can have your cake and eat it too if you start eating it at age 30 or 31, right? So timing is critical.
Yeah.
If you know anyone who's a young professional in their mid 30s, tell them splurge on yourself. That cruise you want to take, splurge and go get your eggs frozen. That birthday gift you've been wanting to give yourself, now's the time. That graduation gift you want to give for your niece or friend who's finishing medical school and is now in their 30s, egg freezing. And in addition to egg freezing, we should be aware of things that can damage the eggs. And I think maybe next time I'm going to, because there are more articles coming out about this that a lot of people are not aware of. There are certain things you can do to fight for your eggs, to try to boost the egg quality. And I think we talked about this in the last episode that we had. There are other things that are now coming out more and more. I'll give you an example. There was an article looking at medical marijuana, right? So since the law passed and it's now legal, a lot of people are using recreational marijuana, not even medical use, just recreational use. A lot of women are also doing the same thing. Well, there was an article that came out that showed that what we call TTC, time to conception, was markedly delayed in women who consume marijuana. Wow. So, bear in mind all this new recreational use, medical use, there can be a profound price to pay. Yeah.
Interesting. Talking of gifts, sorry, I'm going to deviate a little bit. I don't know how it happened, but it did. I poured hot tea on my laptop. And it just stopped working. And, in conversation, just text messages, playing with a very dear friend of mine. He wouldn't want me to say his name here, so I'm not going to get into trouble. So he purchased immediately a replacement for my laptop. And today is the first day I'm using it for Medical Mondays. So I'm going to say thank you. Thank you. I'm just going to say the initial of this person, it's T, just like my name. So thank you. Thank you so much, sir. There's another question. What are the drawbacks of cryogenics? And I'm going to put the person who asked this question on the spot. If you find it tough to tackle.
So we're talking about egg freezing, not freezing whole human beings here, right? So we're going to leave that for the Star Trekky people and the space age people, and we're going to worry about freezing
eggs. Okay.
Single cells as opposed to freezing the entire human body. Now, understand, we can now freeze pieces of ovarian tissue and pieces of testicular tissue in cancer cases, right? So usually you would do that for young girls who have cancer that need to go through some sort of therapy that may be destructive to their ovary. And of course, you cannot stimulate and collect eggs in a 9-year-old or a 10-year-old, but you can cut pieces of the ovary and process it specially and freeze those. And there has been evidence that you can actually recover useful eggs from the cryopreserved ovarian tissue and testicular tissue. But I don't think anyone's freezing whole human beings yet.
Don't be
Dr.
surprised.
Craig. Go ahead. He asked the
Dr.
question.
Famuyiwa, don't be surprised. Things are going on which we have no idea what's happening around us. First of all, thank you for this extraordinary information you're bringing forth. As a man, it seems like a crapshoot to me that you basically get the right egg to do the right thing you want. That's going to produce this wonderful human being that you are now hoping to enjoy and bring forward. There is so many ifs, ands, or buts about it as a man at this point. You mentioned in the beginning stem cells. Stem cells are a process which has been going on, I think, for at least a decade. At least a decade. And an individual who I'm close to just recently received some. The question I have is, yes, we use stem cells to aid the body in repairing and or changing a particular state in the body to a better state. And sometimes we do it well and sometimes we do it poorly. You mentioned also that the new things which are coming forward as in medical marijuana, they impact everything, truthfully. Anything you breathe in reduces your oxygen, period, as far as I'm concerned. And that impacts the body, however small, however large, that's going on. I still have many questions. Maybe if I had you for a half a day and I could sit down in front of you and just question you, it would be fantastic. I'd enjoy it, of course. But again, thank you for this extraordinary information. I see on the chat that someone has asked about PRP, protein-rich plasma, which is being used in regenerative therapies right now, and that is a whole entirely new, different arena which is coming forward. Again, thank you, Dr. Famuyiwa. Appreciate it. Okay.
Thank you. Yes, the PRP is fantastic. We use it in knee injections also. So, to eradicate pain in the knees, and it works fantastic. Even the stem cell injection into the knees. So all of those
there are current ongoing studies evaluating whether it will be of any use with ovarian aging. So stay tuned.
I bet you there will be some good coming out of that. We'll see.
Yeah.
Are men freezing their sperm cells as well?
Yeah.
Yes, absolutely. Because we now know that as a man gets old, there's continued fragmentation of the DNA inside the sperm, inside the nucleus. And the more fragmented the sperm becomes, the higher the incidence of what we call aneuploidy, or what I call genetic accidents. So there is a correlation with age with that. So yeah, if men want to consider freezing their sperm, that might actually be a good idea. And to my knowledge, I don't think that anyone's going to say there's an age cutoff. So anytime is a good time to freeze if they're thinking about it.
There is an area in New York which has been pointed out in some of the research as a hotspot in terms of, I'll say, middle-aged women between the ages of maybe 32 and 44, giving birth. Some of them have used eggs, some of them have not, with a high incidence of inborn errors of metabolism. So, and they don't know what's doing it. truthfully. They think it's environmental per se, but it is real. And unfortunately, children are being born with this, various stages of problems going on. So I just assume that it's something we're still researching, which you are very much aware of, and more information about things like medical marijuana and or alcohol, different various kinds of alcohol. I'm curious if the level of radiation that we are now so comfortable with in terms of our home, our smartphones, our computers, our this, our that, what is the impact of those on the human tissue, human body? Some people are very fragile. Some people are very sensitive. Is it impacting us in ways which I haven't even yet learned?
And
Those
diet.
are all profound issues that you've raised. Certainly, we encourage women who are getting, if you're 35 and older and you come to us for assisted reproductive technology, the technology is now there to figure out if there are some random genetic mutations that are occurring de novo in the embryos before you get pregnant, with the thought that you can avoid some of these things. Now, some patients have said, well, if I test my embryos and they're all abnormal or a mixture of normal and abnormal, then that's it, I'm going to use it. And certainly there have been cases in the literature where women have used those embryos and had normal children. In other words, either the embryos self-corrected, which can happen, or there was maybe an initial error, or the normal cells outgrew the abnormal cells. But there's a cautionary tale with all of this, because in the recent fertility and sterility, there was a case in Canada where they had, and it was a mosaic meaning a mixture of normal and abnormal. Now, we have always called a low mosaic, meaning just a few abnormal cells, and that's all the patient has, we will put that in because you can get normal bursts from that. But in this particular case, there was a high rate of mosaicism, right? So a lot more abnormal cells than normal. And there have been instances in the literature where you've used such embryos and maybe it was able to self-correct and you end up with a normal child. So why not? We'll go ahead and put it. The tragedy was the child was born with severe defects and developmental problems and will probably have to be sustained for the rest of its life. And I think that's really tragic for the parents who've suffered through the pain of infertility for so long, because now that pain is going to be continued, right, for the rest of the life of this child. So we do have the science nowadays to detect those things. It's like, I liken it to trying to catch a train coming through a tunnel and you see it, the light glaring. Well, if you see it coming, you want to get out of the way, right? So the technology is now there because there are some mutations that may be de novo or may be inherited, but you can test it. You can find out. The science is there.
Thank you. Thank you.
Thank you very much. Thank you. Yeah, the science is there. You can even pick if you want a boy or a girl. It's there. You can do that. So there's another question here. It says, can you please go over M1 versus M2s again?
All right, so it's just a phase of division of the egg, right? So without getting into too much science, there's the process of division where you reduce the egg down to one genetic material. It's called the reduction division. And it's broken down into meiosis 1 and meiosis II. And each part is broken down into 4 unique parts: prophase, metaphase, anaphase, telophase. And we're usually referring to the metaphase part, right? So metaphase 1 versus metaphase 2. So that's in this process of the egg maturing and dividing. And if it's completing the division process, if it's further along, you'll be an M2, fully mature egg, versus if it's just starting out and getting stuck.
I hope that is clear, and if you still have questions, you can raise your hand or ask again, and I will read it out. So, how significant is a woman's level of bodily health in this process?
That is a very significant question. I've been singing about that for years. Your health is your wealth. Your body, your eggs will not be healthier than your overall health. You have to take care of yourself and what you expose your body to, right? In fact, there are some women who will say, you know what, doc, let me take a little break here. I need to turn things around. I need to, get rid of some things I'm exposing my body to, try to eat healthier, try to lose weight, try to control my diabetes, certainly try to figure out if you have thyroid problems and get it treated, right? If you have kidney issues. So all those things impact the environment in which the egg is growing. And you see, when you have a cell that's rapidly dividing, such as when you fertilize an embryo and it goes through multiple rounds of division to create an infant, at that stage, if you're exposed to different things, you increase the error load for the cell. There are ways for the cells to make corrections, for your DNA to self-correct. But if you overwhelm it with toxins and oxidants and all that, you may overwhelm the ability to self-correct, right? So, that's why, for instance, radiation is extremely harmful, especially when you're having rapidly dividing cells. With BPA, your phenols. Now they're looking at gases that people may be exposed to. As a quick aside, if you live close to the highway and you're exposed to fumes from exhaust and everything, you may have a delayed time to conception versus somebody who lives out in the farm by a stream and the air is pure and clean. So overall health, it cannot be emphasized enough, is extremely important.
Thank you so much. So, is PRP helpful?
I don't think the jury is in yet.
So, it's been researched. We'll see.
Correct.
And I must say this, I must read this. Dr. Booker, one of your favorites, said,
Yes.
Yemisi, you look gorgeous and so much knowledge in that brain. And my darling brother Ephraim Ajay said, God bless this awesome friend, Honorable T, who replaced my Mark. God bless you, Honorable T. And Dr. Our pastor and attorney Onigbede said, thank you, Dr. Famuyiwa, for a clear and enlightening presentation.
Yeah.
He said he has a question though. If a woman freezes her eggs before menopause and the eggs are viable, can such eggs be planted when after menopause? Can they be planted after menopause? And would such eggs be viable embryo, yield viable embryo? I guess, will they be able to, after menopause, would they be able to, implant these embryos, and can they carry the embryo to term? In a menopausal woman who has frozen her eggs pre-menopause. Excellent question. I love the question.
Yeah,
I
I
love
think
it.
so. If you're looking at whether or not you're looking at a menopausal or premenopausal, right? Is that what you're looking at?
Actually, no, the woman froze her eggs in this
Okay.
scenario pre-menopausal. The eggs
Okay.
were viable when they were young,
Okay,
but the woman is now menopausal. They've reached menopause.
right.
And can they still go ahead to go through the process of implantation, and would they be able to have a viable embryo?
I think what's really most important is the age at the eggs are being recruited, the age at the eggs that the eggs were frozen.
Frozen.
So that's the whole point. The earlier those eggs are frozen, you have a reasonable chance. You have, in fact, those eggs actually are probably going to be much better than, say, when you get pregnant on your own or try to get pregnant at age 40. Those eggs are very good at that early age, and you can use them. They're yours, right? So it might be worth it freezing those eggs before the age of 35.
So, Dr. Nigbide, thank you, Dr. Famuyiwa. But Dr. Nigbide, the woman froze her eggs before menopause, and the eggs are viable. So, like Dr. Famuyiwa said, that is excellent, because the time when the eggs are frozen is important, and they froze their eggs early. But after menopause, see, estrogen has gone down. Hormones have changed in the body. That's really, part of menopause, what causes menopause.
Right.
So in order for a woman to carry a pregnancy, normally, whether it is by in vitro fertilization or normal, there are different hormones that have to act at different stages of when the pregnancy occurs. When the pregnancy is growing, there has to be. We have a case here that was actually nationally known, a senator who actually ran for president. I won't mention the name. They lost a child, I think, around that time, and the wife was already postmenopausal and wanted to, have another child. So she has to be put on certain hormones to get her body ready and all of that. She died of breast cancer later on in years. If you guys remember, I don't want to, go into details of that, but she did carry pregnancy, postmenopausal, and she had the baby. However, hormones had to be manipulated in order to get her there, but it can be done. Because
absolutely, all the time. Yeah.
it can be done.
The only thing that's important is how healthy is the patient. It has to be, make sure that it's you have to make sure that you can definitely support somebody who's menopausal into getting a child. You just have to make sure they're healthy. And I think nowadays most high-risk pregnancies would say, try not to conceive by age 52, right? Because you worry about that, So you don't want to have somebody who's trying to get pregnant at that age, because you worry about is the person healthy enough, and you look at the age, so we usually say by age 52 you don't want to get someone pregnant at that age, because there's a lot of stress on the body at that age, so we worry about that.
So, Dr. Craig, I'm going to revert back to you in a minute, because I know you have your hand raised, but Sister Candice asked questions that has to do with what we're discussing right this minute. So I want to read out her question. She said, at what age is IVF recommended? That's one. Freezing eggs buys time, and a person could think they have a lot of time and wait until their 40s to use the eggs. What is the success rate for IVF for someone in their 40s? How do you feel about the use of Neupogen?
I think you have to, you have to look at somebody who's, you have to look at the age of someone. You have to look at the age of freezing. I don't think anyone is going to advocate IVF at around age 43. You probably, you have to be very careful. It's just that the success rate is not very good.
So I don't think she's talking about the freezing. She said the eggs had been frozen.
Okay.
What age? At what age is IVF recommended? So the person already had frozen their eggs early, maybe in their 20s, maybe in their early 30s.
Right.
But she's saying, and they freeze the eggs to buy time.
Right.
She says, and the person could think they have a lot of time and wait until their 40s to use the eggs. She wants to know, is it okay to use my eggs that are froze in my early 30s when I'm 40, 48, for instance?
Absolutely.
That's what she's asking.
Yeah, you can definitely use your eggs because you're using young eggs at that time. So though that's really totally doable and reasonable, because you see, at that point, your success rate is not the success rate of your age. It's the success rate for when the eggs were thawed, right? So that's actually why this whole technology came about, is for women like that who froze their eggs in their 30s and are now using it in their 40s. That's what this technology is built for.
Okay, then she says, how do you feel about the use of Neupogen? Neupogen.
I'd have to look it up some more to see if I can give you an answer on that.
Okay, I think that was just repeated. So Dr. Will?
Yeah.
Go ahead, Sam.
Just a quick statement. And I don't know, as you've just said, the application of PRP in this area at all, but it is actually being used almost globally in sports, in terms of with sports people who are injuring, tearing this, injuring that, etc. So it's a well-known treatment process for all of the sports people who are damaging themselves. Again, in this arena, I don't know of it at all. One other thing, you mentioned about I'll say hormonal balance. That is very difficult to achieve, and because you don't know. Well, it has to do with the woman's body and what's going on at her age, etc., to bring that balance into play so that it works for the process of fulfillment in terms of egg saving, good egg capture, etc. So that was my statement.
Okay.
Thank you. Thank you so much. Auntie Tower, you have your hand raised, ma'am.
Good evening, everyone.
Good evening.
Good evening, Dr. O.
Good evening, ma'am.
Good evening, Dr. Famuyiwa. Thank you. My question is not much, it's a little small question. If one gets donor egg, is there a possibility of rejection when it is being implanted after fertilization?
No. No. When we do transfer any embryo anyway, even if it's your own, there are certain medications that you're given at the time of transplantation, transfer to help prevent such thing. But you're probably looking at the conversation of people who have recurrent pregnancy loss. But we're not really worried about are they going to reject the egg or not. It's either going to fertilize and implant or it won't fertilize and it won't implant. And if it doesn't, if you're going to, you're not going to put it back in if it doesn't even fertilize, because we can see in the lab before we put it in that it has to be a viable embryo before we put it back in. And you can also test it, which is what we talked about, to see if it's genetically normal before you put it back in. Yeah.
So, Antitawa is different from transplant. In transplant, it's when, rejections can occur and, the immune system has to be suppressed and that person receiving that foreign organ or whatever is being transplanted. This is different. Yeah. So there is no
rejection. Are they tissue?
The egg is a tiny cell that you can't even see with your naked eye. You'd need a microscope.
Mm-hmm. I know.
So
thank you very much.
Thank you, ma'am. Dr. Buka, you have your hand raised.
Yeah, I just wanted to find out. Someone says even if you get a donor egg, the child still gets some bit of DNA from you or something transferred to you. That's one question.
Well,
and
not so. Yes, go ahead.
Yeah. Okay. That's
So yeah, answer that first, and then you can ask the second one.
So not so much DNA, other than the fact that the baby is growing within you as the incubator, right? So your blood system is sustaining this child. It's intimately connected with the placenta, the uterus. You're diffusing molecules and chemicals across the placental bed, and the nourishment is coming from the mother, right? So, and there are some people that say, well, yeah, I know I could adopt, but I actually want to experience carrying the pregnancy myself. So there is some of that gratitude in that, but not necessarily the DNA.
And I was a recipient of, I had IVF and I was lucky, so I'm fine at 40. But I had PRP for my Achilles tendon. And, it's easy to see, but that thing is not a joke. You're immobilized with your boot for 2 straight weeks. So saying PRP, I don't know how it's going to work. You cannot even run to the bathroom without your boot for 2 weeks. So I've been through it. So I know the hell of, but it worked. It helped my Achilles tendon to heal. Mm-hmm. Thank you. Mm-hmm.
Thank you, Dr. Booker.
Thank you, Dr. Booker. See, that was for Achilles tendon. For the knees, it's different. They put, the brace, the knee brace helps, for a bit and physical therapy, but it works there too. And it's not that bad, but it works, right? So
it works well when you have to run to the bathroom in the middle of the night. With your brace on the floor, you're putting it on and getting to the bathroom.
I agree with that. That is not fun. I agree. So, Sister Hilda, go ahead, kindly unmute.
Oh, so every time I come to your presentation, Doctor, I learned so much. And I like every time you put a new twist to it, you new information, new knowledge. And I have a question regarding, we say a lot, and I have been hearing this even when I was much younger, that, people stay longer in school, and when they finish school, they want to finish, they want to gain experience at work before they even start talking about marriage. And even when they get married, they want to first do the honeymoon spend 2 years going on all kinds of vacations before they even think about having babies. So for that reason, freezing the eggs becomes really a priority. But I'm
Yes.
wondering, given all the risks associated with freezing eggs and the frozen eggs not maturing and maybe not delivering what it's supposed to deliver, do you sometimes give, talks at universities?
I think I would, if you know a forum where I could show up and start talking about it, I am talking wherever I'm going to be allowed. So if you
Okay.
know a forum where you feel that this message is timely, by all means, please share, and I'd love to show up. Let me know. You have my
Okay.
contact from Dr. O.
Okay.
But I do think that it's a message that needs to get widely disseminated because it's not getting disseminated enough, right?
Yes.
So, if you please know any forum where, I can give this talk. I know I'm giving a women's summit in a couple of weeks. I was invited by a pastor there. So I'm excited, I'm fired up. But if you know a place where this is timely. One of the lectures I gave several weeks ago was talking about egg freezing for doctors. I don't know if you guys remember that, because I did, and I write blogs. If you go to my website or my LinkedIn page, there's a blog I wrote called Egg Freezing is Probably the Best Gift You Can Give a Medical School Graduate. So if you go to my LinkedIn post or go to my website, you will read that blog. I wrote about it because infertility in doctors is 1 in 4, whereas in the general population is 1 in 8. So it's double the general population. So as a matter of fact, they're the ones that need to be hearing what I'm talking about. So if maybe I should be calling my old medical school at Emory University and say, hey, maybe we need to tuck this into the medical school curriculum. But I think that they're the ones that need to hear this. We have a lot of women in tech, in IT, who are doing fantastic stuff. We need to tuck that in somewhere in the IT curriculum.
Yes.
We're seeing women who are nuclear physicists, and hopefully they'll be going up to the moon and Mars pretty soon. Well, hey, before you go, let's do this first. So, and it doesn't take that much time, a couple of weeks out of your life to sort this out, so that you can, go get your dreams. Your dreams should not be truncated. You shouldn't be miserable with what you do with your life because you did not pursue your goals and your dreams. You can do it, but keep this somewhere in the back of your mind. And if you can't even afford it at the time, maybe get 4 or 5 older family members and say, hey, listen, I want to take a temporary loan because I know that when I finish my PhD, when I get my doctorate degree, I'm going to be making money. And here's a promissory note. I will give you back your $2,500 each. Help me out.
Well, there's a follow-up question that is in line with that says, can you discuss the cost of freezing?
Yes, I know in my clinic, we charge $6,950 for the whole process. It does not include the cost of medication. It does not include the cost of the initial workup. Like, I can't just grab you off the street and start doing it. I need to know what your hormones are. I need to do an initial ultrasound. The fortunate thing is we live in Maryland, and most of those preliminary workup is covered. So we're able to get that covered. Now, here's the thing. If you freeze your eggs much earlier, you end up not using as much medication, so you end up spending less money. If you end up freezing later and you end up using more money to buy more medication because your body just needs that much, then it becomes more expensive. And of course, if you're freezing it a lot later, and I'm telling you, yes, I kind of like it, but I would recommend you do a second cycle, right? So the earlier you do it, the cheaper it will be, but that's where we start.
So the 6,950, is that
Yes,
out of pocket costs? Since
Yes,
medications and lab
medications not covered.
MRI are covered. by
Medication
insurance.
may not be covered. Medication may
May
be
not
in
be?
addition. No.
Okay.
No.
It may not be covered by insurance.
Correct.
So this 6,000.
Some insurance plans are now recognizing that this is no longer a luxury, and they are now making provisions to actually cover egg freezing. And those typically, you would see that in someone that works with the big tech companies like Google and Apple. They're paying for that. They're paying for it. I think Facebook's paying for it. So some individual companies are recognizing that this is very, very important. And they are actually purchasing what is called a carve-out plan that actually will cover it. So I know we just did a patient who worked with the New York Times. Yay, shout out to the New York Times, and it was covered.
So all of these companies you mentioned, New York Times, Facebook, Google,
The big ones.
cutting edge. Maybe Amazon, maybe even join them.
I think so, yes.
They are the cutting edge, and hopefully others would follow suit. But that
Yes.
money for freezing, how long does it cover? Do the person still have to be paying like a storage fee?
Yes, storage fee is not included. And since we don't know how long you're going to keep your eggs, we don't encourage long-term storage in our facility. There are now facilities all over the US that can store it indefinitely, and they store it in silos where it's hurricane proof, tornado proof, earthquake proof, fireproof, indefinitely. Yes.
Fantastic. Thank you. So, Pastor and Attorney Onigbide said the answers are clear and well understood. Thank you.
Thank you.
Sister Karen says, thank you for sharing your knowledge. What's the success rate of donor egg or embryo adoption from 34 to 41 women?
Oh, so that is a very broad range of age. We don't group 34 to 41 in the same avenue. So obviously a 34-year-old is going to have a very, very high success, especially if they do genetic testing. If you have up to 3 normal embryos, you have a 95% chance of walking away with a live birth. Now, untested embryos, you're going to get lower. And of course, as you get older, if you are able to get genetically normal embryos, notice the big if, and you have a normal uterus, then you have a very, very high chance of walking away with a child. So it depends on the age of the eggs. Do you have a normal uterus? And is the embryo genetically normal? If those things are there, then you have a very reasonable chance of success, even with the first attempt. But if you have up to 3 genetically normal embryos and the uterus is fine, you can get up to 90%, 95% take-home baby rate.
Fantastic. Fantastic. So I have another question. What supplements would you recommend before egg freezing or IVF?
Excellent. So I usually use the Theranatal brand of vitamins. I like them because they've actually done the brain work for me, and they've put in every single thing that you need, your vitamins, your B12s, your vitamin D is important, vitamin E, your K vitamins, and then they throw in their antioxidants like CoQ10. So for women younger than 35, we would go with what is called the Theranatal Core Vitamin. It has everything you need. And over 35, they have the Overvite that throws in CoQ10. And then some women, I do check their androgens as well. I may throw in the melatonin brand of the vitamin called Serotonin or DHEA for those women if they're older. And those are all supplements that you can use.
Fantastic. Can you do me a favor?
Yes.
Can you put that in the chat box, please? I am sure that, it will be helpful for the person who asked it to actually have a visual.
So let's see.
So
Less than 30.
Less than 30, yeah.
30,
So because, there are different ages for different kinds of supplements. But all of these things, it's always best to have a physician monitor and walk you through the process. So if you're in Maryland, Dr. Famuyiwa is one of our best, so hit her up. And Pastor Dr. Fawale, our very own Dr. Fawale said, thank you so much, Dr. Famuyiwa. And she said she'll be sharing this valuable information in our circle of influence. Thank you. It's very important. And
thank you. And like I said, if you know any university setting, any corporate setting that would like to hear this, please give me a call.
And Sister Karen also said thank you for answering our question. There's another question. Please let us know what is the protocol for repeated IVF losses.
You mean repeated implantation failure, that's kind of broad. So the question is, when you say IVF loss, are you talking about pregnancy loss or failure to respond or failure to get eggs that develop? One has to break down exactly what is going on. So
she says
if you have
implantation failure,
repeated implantation failure. So there are a lot of things you could do. I think when you have repeated implantation failure, one of the things we do for sure is make sure you have a genetically normal embryo. That's the first thing. Number two, what's going on with the uterus? It takes two to tango. You know what I mean? So what's going on with the uterus? Do you have any issues with the uterus? Sometimes we actually test receptivity for the uterus. Is the uterus capable of receiving the embryo? Do you have a chronic endometritis going on that needs to be treated? So there are a lot that you can try initially. So one would have to say, okay, I need to see the breakdown of what's going on to address that specific issue.
Thank you. Thank you so much. And by God's grace, your next one would work.
Yes.
Dr. Famuyiwa is right though. And sometimes it takes a few times, a couple of times or a few times for some women for it to work. Dr. Fawale says she wonders what can be done for women without documentation who need this service. I would answer that question. So for general health, community health centers will see undocumented people. We are bound not to ask for immigration status. Please, it is important that you know that. And the costs of care, seeing the physician, labs, everything that will be done is never more than $25 per visit, everything included. I was chief of medicine at one for 6 years, so I know the protocol. Immigration status must not be asked, so healthcare is free. But the level of care we're talking about is not done at this level. OBGYN, dental work, general health, pediatric care, all of those are done, but not IVF. As we talked earlier on, most insurance companies are not even covering them. They are not covering IVF. It's out of pocket expense. So if these undocumented people have money, yes, they go to the doctor and pay cash. The $6,950 that Dr. Famuyiwa charges is cash. So whether you documented or not, it's not her concern. It's not us, doctors. We don't know your status. We don't want to know your status. By law, it's not our business to know if somebody is documented or not. We just care about you being healthy and getting your health needs met. So the same with this process, they can see Dr. Famuyiwa or any infertility specialist, and they will take care of them because it's mainly cash anyway. So, did I answer your question?
Yes, you did. Thank
Thank
you.
you. Thank you. So
Thank you.
there's a comment here that IVF is covered by health insurance if the parents have a medical need. I don't know, Dr. Famuyiwa. No, that's not my experience.
Not really. No,
That's not my experience. Exactly.
no, 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 it's not. You need to know your insurance policy. Just because you have a particular insurance carrier doesn't mean you're covered, because if it's through your job reserves the prerogative to drop certain things off the plan, right? They may not just, they may say, well, we don't want to cover fertility, so it's not covered. So you need to know your particular plan. And a lot of people get confused. They'll say, well, I have coverage. Well, your plan may allow you to be covered for the workup, and it's called diagnostic coverage. You're not covered for the treatment. And so when patients come to see us, we have to educate them that, oh, well, not quite, not so fast. Here's what covered, here's what's not covered. And sometimes the medication may be covered or may not be covered. You need to know now, if you live in Maryland, you can buy Blue Cross Blue Shield on your own and get coverage for fertility. So a lot of times I'll tell my patients, if your employer is not providing coverage, go buy your own. Go buy your own. You can get it from Blue Cross Blue Shield. But it doesn't apply to people in Virginia or Maryland, DC. It's because Maryland is one of the few states in America that have what is called the fertility mandate. So if you buy a policy, not all the policies, by the way, so don't go argue with them. Certain policies will provide, you're given that option to buy one that does cover you. It won't cover egg freezing. It will not. Yeah.
So health insurances are different. You just have to pursue the one that you have, or ask the one you have what they cover or don't cover. Every insurance decides what they pay for. And employers, like Dr. Famuyiwa said, decide what they want to include in whatever package they give into their staff. So it differs. And we are not experts at that. So when patients come, we just find out what the insurance covers or not cover, right, Dr. Famuyiwa?
Yeah, I mean, a lot of times I tell them, you really need to be your own advocate and know what you're, because, at the end of the day, I tell the patient, look, that's your policy, it's your policy. You need to know what's in there. And it's not, we don't control it. Please don't get upset with our office. We have nothing to do with it.
Exactly. So, Auntie Tawa, you had your hand raised, ma. You can unmute.
The question has been answered.
Oh.
Yeah.
Okay.
I was going to ask about the insurance, whether there's other insurance that carries, that you can buy separately for the purpose.
Oh, Dr. Famuyiwa can answer that.
Yeah, if you buy it, it will cover fertility. Egg freezing is not part of it, though. The only coverage for egg freezing are companies that choose to provide that. And the reason the IT companies are providing it is because they're competing for the best brains out there. And the best brains can say, well, you know what, Apple, you're not going to pay for this? Well, hello, Google, So those companies are competing for talent, and they're using fertility coverage as one of the enticements. But not everybody is doing that. Maybe not everybody can afford it, You're talking about billion-dollar corporations and trillion-dollar corporations. That's like not even a drop in the bucket. I don't even think it registers on the radar for them. They don't care. Well, they do care. They want the best for their clients. So they are starting to buy those policies for their patients. And if you call our office, we can tell you which carve outs your company can be interested in. I've actually told some patients, hey, you're your own advocate. Go get your friends, go up to HR and tell them this is what they need to get. And they have. So there's power in numbers,
That's right. That's right. So Sister Candice said, this was absolutely amazing. Thank you so much. May God bless you all.
Oh, thank you, Dr. Booker. I just read Dr. Booker's comment.
I'm not there yet. Back on the bottom. You gotta wait.
So I didn't finish my questions.
Oh, go ahead. You said you asked it.
Yeah, the other question is, she was talking about normal uterus. Which one is abnormal uterus? Which one is normal uterus?
Okay. If you have a uterus that's overridden by fibroids, well, that might be a problem. If you have adenomyosis, that might be a problem. If you've had radiation, I had a patient that had uterine artery embolization done not once, not twice. That could be a problem.
In the reproductive age, who did that?
Yes, yeah, that's exactly what I was asking her. I mean, it was done twice, and I'm thinking, why would they do that?
In a woman,
because she had a small fibroid on the inside of her uterus.
Wow.
Yeah.
That hurts. Okay.
Exactly.
Whoa. Ooh. Oh my gosh. Okay, I have to. Dr. Ephraim said, good answer. Thanks, Dr. O. I don't know what to answer. They said, our lives and care are very important. Let's ask questions and get help when needed, health-wise. The Amish community rely on themselves for all their health needs. They make contributions a lot for one another. Even health insurances don't cover everything sometimes. Just food for thought. That's excellent food for thought. I mean, if we do what we should do, we should really be a village. It's not out of reach to have a pause where people can afford it just contributing to. And when somebody needs, egg freezing, like we're talking about, to just take out of that pocket and pay for them. We have a Nigerian center now in DC that can be done through that. That this is money for IVF, people who want to do it and that can afford it. Because really, we need to increase in population. It's all about numbers, though, at the end of the day. I'm telling you, this is important and it's become a big problem. I'm seeing so many young women who can't reproduce, and young men, because sometimes we think it's only women problem. It is not. Sometimes the man is the issue. And we've talked about that a little bit before here too. Yeah. So Dr. Booker said, Dr. Yemisi is an excellent doc. She was a doctor since she was a resident at Georgetown University Hospital. And our very own Dr. Booker, our anesthesiologist, she doesn't mix words. So,
I think Yemisi saved me. I think I sent her into infertility because she diagnosed me better than her attending. So I think she was just a second-year resident. I think I prompted her for her fellowship with all my problems.
So it was because of you she went into fertility medicine.
Maybe because she helped me to save my uterus. So for her attending.
Thank you.
Thank you.
Thank you is still in order after all these years, because guess what? You got your daughter out of it. Thank God.
A wonderful daughter too.
Wonderful daughter. Thank God.
Who is her patient now? She's now Yemisi's patient.
We go full circle.
Mind you, I can boast about it now. She's going to make her Broadway debut in another month.
Oh, we had a deal, Dr. Booker. She was supposed to send me an invite.
I didn't tell you. She will get back to you.
So the question that Dr. Ajay was talking about regarding the documentation and undocumented
Right.
individuals. And
Right.
yes, he agrees that numbers matter. So
Yes.
thank you so much. What an amazing night. And so much that we have learned. And again, I thank the women who are on this platform. We don't take that for granted tonight, but especially the men. Thank you for coming. But you'll agree with me, men, that you learned a lot that you can take back now. So women in your circle, women around you, this is an issue that impacts everybody. And I'm so glad you came, because when people see that topic, they usually like, but it doesn't concern me. Some people have texted me and said that, but this one does not concern me. I say, come and hear it. And afterwards, they say, oh my gosh, I'm glad I came. So thank you so much, Dr. Famuyiwa. I'm going to defer back to you to give us, your closing words, and also remind everyone on this platform that we have not, and we are not developing physician-patient relationship. This is a forum to just learn and grow together. Over to you, Dr. Famuyiwa.
Well, Dr. Opesanmi, thank you so much for giving me this platform. I'm very, very grateful, because this lets me talk about something that's really near and dear to my heart. I'm very, very a passionate advocate for my patients. I love what I do. And it's so rewarding when you can actually make a tangible difference in someone's lives. And this is something that's very painful for a lot of women. So I'm here to destigmatize it. I'm here to encourage women, to empower them and say, come on, we can do this. Don't give up. So thank you for this wonderful platform. And as I say, if you know of any other platforms that can do with this news, this message, please send me a message and I'll be happy to oblige. Thank you so much, everybody.
Thank you. Thank you so much. And you know me, I hit you up. Can you talk here? Can you talk here? We'll be doing it because it is important. And all I encouraged, Dr. Ajay said, to share our YouTube and Facebook links, and also contact Dr. O to book Dr. Famuyiwa for speaking engagements.
Thank you.
Thanks so much. And
thank you.
My darling Sister Mary says, thank you so much, Dr. Famuyiwa. She's in medicine also, and she's doing, similar to what we are doing. And, so thank you. Thank you, everyone, for coming, for participating. You make Medical Mondays with Dr. O. Thank you.
Thank you.
Thank you. Thank you very much.
Nice.
Thank you. Good night.
Excellent information.
Good night, everyone.